Hello everyone, welcome back to Study. Today we are going to discuss about Goldmann Applanation Tonometer. In the previous videos we have discussed about tonometry, what is tonometry, what tonometer is, and what are the types of tonometry. I have discussed short tonometer in very detail in the previous videos. The link are mentioned in the video's description. You can just see them, and in case of any confusion you can watch them. So now today we are going to discuss about applanation tonometer, which was another technique used in the indirect method of measurement of the intraocular pressure. So in applanation technique, our main aim is to flat the corneal surface. So in applanation tonometer, we make the corneal surface flat or we make it plane, right? This can be done by a lot of techniques, which can include the non-contactable or the contactable technique. So the instruments can be classified into non-contact and contact. The contact means that you are going to touch the corneal surface. आप cornea की surface को touch कर रहे होंगे and you are going to make the corneal surface flat. The non-contactable technique will involve that you are not going to touch the cornea. The instrument is not going to touch the cornea, but still it will make the corneal surface flat. So here you can see that contact surface include the Goldmann tonometer, and this means that Goldmann tonometer is going to touch the corneal surface, right? And Perkins tonometer. And in non-contactable we have pneumatic tonometer or the air puff, where you make the corneal surface flat by popping the air into the patient's eye, right? That air will make the corneal surface flat, but you are not touching the cornea. So today our main aim is to discuss the Goldmann tonometry. So let's move on. So now Goldmann tonometer is a gold standard. It means that it gives very efficient and accurate reading and is most commonly reliable technique, right? So its other name is Goldmann Applanation Tonometer, which is actually attached or is slit lamp mounted. So it is attached or connected with a slit lamp. So in order to use Goldmann Applanation Tonometer, you need a slit lamp. Next thing is that it requires anesthetic drops. For this you need to anesthetize, or you have to give the anesthetic drops to the patient, because we know that cornea has a higher sensitivity. So when the cornea is highly sensitive, it has a huge highest nerve supply. So when you are going to touch the cornea, it will give you sensations. That sensations will, in response to that sensations, what will happen, the eye will blink continuously. So it can damage, or for reduce that blinking you need to anesthetize the eye. And for pain also, that when you are going to touch the cornea, you don't feel any pain or you are senseless at that point. So that is why you need to anesthetize the eye. So when a patient comes to you, you need to add the anesthetic eye drops, that can be alkane eye drops, that can be propagane. So you need to add those eye drops. So now when you have added the eye drops, you need to do second thing, which is you have to add the fluorescein dye into the patient's eye. So now how you are going to perform the Goldmann Applanation tonometry? When a patient comes to you, you have to add the anesthetic eye drops and you have to put in the fluorescein dye. It's a small strip that you'll just put, or you'll just touch the lower eyelid of the patient, and it will, and ask the patient to blink, so that dye will be spread into the whole eye. It's actually orange colored dye, and you have to wait for at least 5 minutes approximately, right? 2 to 5 minutes, yeah. So now your patient is ready to be observed. Now let's see that what is a principle, then we'll discuss some cases. So now the Goldmann Applanation Tonometer is based that you have to plane the corneal surface. But how you are going to make the corneal surface plane? This is based on the Imbert-Fick principle, that is mainly on the 3 points, or that is mainly focusing on the 3 factors, which is the force, the pressure and the area. In physics you have discussed that pressure is equals to force per area. So that is the Imbert-Fick law, that is making focus, or that has a focus on 3 factors, which is pressure, which is inside the sphere, right? Over here we are going to discuss the sphere, or we are considering the sphere as a cornea. So the pressure inside the cornea, right? And force, force which you are applying for the flattening of the sphere, right? So you need to understand this thing very importantly, that the pressure is coming in from the cornea, and force you are applying in order to applanate or making the surface plane or flat. And the third is the area, which is the area of flattening, how much area you are making flat. So how much corneal surface you are making flat, that is the area. So now what is Imbert-Fick law? It is actually saying that pressure inside an ideal sphere, now they are saying that pressure inside an ideal sphere means the pressure inside the eye. Over here you can see pressure inside the any ideal, we are talking about ideal, I'm just relating it to the cornea, but I'll going to discuss about some conditions other than that which are also acting on to the corneal surface. But right now you just need to understand these three factors very carefully. So I have told you the pressure is inside the eye, which is any dry thin surface, right? So pressure is actually an ideal of an ideal sphere. Sphere ideal कैसा होता है? It is actually the circular shape. So ideal sphere is equal to the force necessary to the flattening its surface. So you need to flat the surface, वो force, and divided by the area of flattening, जितनी surface को आप flat कर रहे हैं. So now P equals to FA, but we all know that here this phenomena says that you have the pressure of an ideal sphere. But we all know that cornea is not a sphere, cornea is aspheric, right? So for that you should understand this thing. Here you can see that it's a cornea shape. So can you just say that yes, cornea is spherical? So no, the cornea is not a spheric structure. So for if it's not sphere, so how much forces are acting on it, right? So there are two additional forces which are acting onto the corneal surface. So we are going to add these surface, or we are going to correlate these surfaces with the Imbert-Fick law. So we have a modified Imbert-Fick law that says that cornea is not a spherical structure, rather it is an aspheric structure and two additional forces are acting on it. अब कौन सी forces उन पे act कर रही हैं? So one is tear meniscus force or attraction, and other is corneal rigidity or power to maintain its own shape. So now this is very important thing, we are going to discuss it over here. So as you all know that onto the surface of cornea there is another layer which is tear film, which provide nutrition and which helps the tears to stay over it for reducing the friction and many other purposes of, there are a lot of purposes of the tear film. So now we all know that there is an additional layer on the surface of cornea. So when you are making the corneal surface plane, or when you are touching the Goldmann tonometer with on this cornea, so what is happening? It's not only the cornea, there is another additional layer over there. Okay, so अब मैं कहना क्या चाह रही हूँ, इट इज़ एक्चुअली जो कॉर्निया की सर्फेस है दैट इज़ एस्फेरिक, राइट? वी ऑल नो दैट. नाउ अगर कॉर्निया की सर्फेस एस्फेरिक है, सो कैन वी रिलेट इट टू द Imbert-Fick law? No, we cannot, because Imbert-Fick law says that it is a dry thin walled structure. Sphere is a dry thin wall, but cornea is not a sphere. There are two additional forces that are acting onto the surface of the cornea. One is a tear film, right? We all know that cornea is covered with the surface of tear film. So जब हम टोनोमीटर टच करते हैं कॉर्निया से, सो वी आर नॉट स्पेसिफिकली टचिंग द कॉर्निया और वी आर नॉट डायरेक्टली टचिंग द कॉर्निया, देयर इज अ लेयर विच इज़ द टीयर फिल्म. तो जो टोनोमीटर है दैट इज टचिंग द टीयर फिल्म एज वेल एज द कॉर्निया. पहले वो टीयर फिल्म को टच करते करते कॉर्निया को टच करता है. सो देयर is a force which we are applying by the tonometer that will be added to the tear film force, क्योंकि tear film की भी तो force है that is continuously attracting the corneal surface so that tears may not be apart or they may not displace or something. I can say that tears जो हैं वो आई के ऊपर स्टे करें, दैट इज़ वाई देयर इज़ अ फोर्स ऑफ अट्रैक्शन ऑफ द टीयर मिनिस्कस विच इज़ अट्रैक्टिंग द कॉर्निया टुवर्ड्स इट, राइट? सो टीयर्स आर अट्रैक्टिंग टुवर्ड्स कॉर्निया ताकि वो वहाँ स्टे कर सकें, आई ड्राई ना हो सके. सो व्हेन यू आर अप्लाइंग अ फोर्स, तो वो फोर्स और टीयर की फोर्स आपस में कंबाइन हो जाती है, राइट? और वो कंबाइन होकर कॉर्निया पे एक्ट करती है. नाउ अब कॉर्निया के अंदर का प्रेशर, राइट, वो प्रेशर जो कॉर्निया के अंदर है हम वो मेजर कर रहे हैं, बट स्टिल देयर इज सम फोर्स दैट विल हेल्प द कॉर्निया टू मेंटेन इट्स शेप, दैट इज द कॉर्नियल रिजिडिटी, राइट? एक फोर्स वो है जो बाहर से हम अप्लाई कर रहे हैं, एक फोर्स वो है जो टीयर मिनिस्कस कॉर्निया पे अप्लाई करिए ताकि जो टीयर्स हैं वो कॉर्निया की सर्फेस पे स्टे कर सके. दैट विल एड अप, यू कैन सी ओवर हियर F plus T. सो एंड माइनस सी मीन्स दैट एक फोर्स वो है जो कॉर्निया के अंदर से लग रही है सो दैट इट कैन मेंटेन इट्स शेप. सो हियर एक फोर्स है जो इसको कह रही है कि फ्लैट नहीं होना, राइट, बट वी आर ओवर हियर गिविंग अ फोर्स कि वो जी फ्लैट हो. सो दिस forces over here will make a modified Imbert-Fick law which will state that force जो हम apply कर रहे हैं will add to the tear meniscus force and will subtract from the corneal rigidity, which is actually the force that is applied by the cornea so that it can maintain its shape. So modified Imbert-Fick law states that pressure inside a cornea is equals to F plus T minus C divided by area. So this is a modified Imbert-Fick law on the basis of which Goldmann Applanation Tonometer acts. So now अब हम वापस चले जाते हैं अपने बैक प्रोसीजर पे, where we have said that we have anesthetized the patient, we have added the fluorescein dye into the patient side. This was all about principle जिस पे Goldmann tonometer act कर रहा है, right? So now we are going to the procedure. So there is a measurement tip in the attached to the Goldmann tonometer. Over here we will just see, you can see this tip which is attached to the Goldmann measuring device. So this tip is the measurement tip. So this measurement tip can be used once or can be used multiple times after the sterilization. You can sterilize it and after cleaning it you can again use this tip. So here this tip you should align, or just when you are connecting this tip to the measuring device, right, so you need to align 0 of the measuring device with this long line of the first line of the measuring tip in order to get the measurements, right? So now what this measuring tip consists of, or why are we attaching the measuring tip to the measuring device? Why can't we just use the measuring device for the measurement of intraocular pressure? This measuring tape consists of two prisms which will give the view of the cornea, right? How it will give? This will give you the corneal surface, or this will give you the view of the central cornea surface which you are going to plane. वो किस तरह से? It will give you a circular image which will be actually divided into the two semicircles. सही हो गया? So biprism consists of circular area of cornea converts the circular cornea into the two semicircles. I have told you it will show you the view of the circular cornea which you are going to flat into the two semicircles so that you can actually read the value of the intraocular pressure. That is why it is the indirect method, because you are not calculating the intraocular pressure directly, rather you are indirectly trying to measure the intraocular pressure. So this measuring head or the measuring tip consists of two prisms which will convert the central circular surface of the cornea into the two semicircles. अब semicircles का क्या काम है? First of all, before moving it into the detail that how you are going to see the semicircle, you should know that okay, how you are going to view, कैसे काम करेंगे. So now you need to look through the eyepiece of the slit lamp and make sure that these prisms are horizontal straight line. So these are the basically prism जो हम bi prisms discuss कर रहे थे वो ये prisms हैं. You need to make these prisms horizontal. Here you can see ये बिल्कुल straight horizontal है. So you need to make these prisms horizontal so that in order to view the semicircles, right? अगर आप इसको इस तरह नहीं करेंगे so you will not get the semicircles, or you will cannot see the semicircles. So now before again हम interpretations की तरफ जाने से पहले discuss करेंगे that how you are performing or how you can perform it. So now you have seen through the eyepiece, you have made them horizontal. You have to see there in the measuring device there will be a knob on this side of it which is actually the measuring dial or the wheel from where you have to measure the intraocular pressure. अब pressure कहाँ से measure करेंगे? From this wheel. Okay, so ये measuring device के side पे है. Here you can see the reading is 0, 1, 2. Now are we going to say that if it's, you can see here it is, so it is approximately 1.1, okay, 2, 3, 2, 4, 6, 10. So can we say it that it is 1.1. No, it is not 1.1 or 1.2. It is actually, you have to multiply these readings from with the 10. तो आपने क्या करना है, you have to note the readings from this wheel and just multiply it with the 10, so that you can get the intraocular pressure reading. So you need to measure or calculate the reading from this bar. Now, very important thing that you have to set the wheel at 1. 1 means that you have setting the reading at 1, or you can actually 1 or 2. Yeah, you have to set the wheel at 1 or 2 instead of 0. Right, अब मैं अगर 1 पे कर रही हूँ, so it means it's actually 10 millimeter of mercury intraocular pressure. अगर मैं 2 पे कर रही हूँ, it is 20 millimeter of mercury. Now why not 0? It is because when you will make it 0, measuring tip vibrate करना शुरू हो जाएगी. So that is why if measuring tip starts vibrating, it means that you are going to touch the corneal surface. आप cornea को touch कर रहे हैं और वहाँ पे measuring tip जो है वो vibrate करना शुरू हो गया. So it can cause damage to the corneal surface. So that is why you need to make the reading to the 1 or 2, so that you can measure further details of the intraocular pressure. Right, we are going to discuss, but before getting into it, very important thing that you have to turn the reading approximately at 1 or 2. And one more important thing, that you should remember that you are touching the corneal surface. So each and every reading you are going to take, you have to be very careful. Right, you don't have to damage the cornea. So it is very important to consider each and everything while you are measuring the intraocular pressure with the help of the Goldmann Applanation Tonometer. So now I have told you that biprisms will give you two semicircles. How? By changing the circular area of or circular region of the cornea into the two semicircles. Now, how you are going to view it? Remember, I have told you that prisms should be horizontally, or they should be horizontally placed. So these here you can see, you have to view. One more important thing, that you have to turn on the blue light from the slit lamp, so that you can get the blue image. And when you are going to see the blue, here you are going to see the green colored semicircles, which was because of the fluorescein dye. Right, so now you have to slowly touch the cornea. Got it? You are just slowly touching the cornea so that you can get this image. Now again we are going to revise. You have a patient comes to you, you have anesthetized his eye, fluorescein dye is inserted. Okay, you have asked patient to sit in a proper manner, how you ask the patient to sit in slit lamp, just like that, or in auto ref, so that he's actually in the comfortable position. Now you have to say that the patient does not have to move his eyes continuously, he should see straight. Now आपने blue light, you have just on the blue light of the slit lamp, and attach the measuring tip with the Goldmann tonometer, turn the reading to the 0, and turn the measuring wheel, the wheel or the reading wheel to 1 or 2, which is actually 10 or 20 millimeter of mercury. Make the prisms horizontally straight, and you have to turn the blue light, and just now you have to go slowly towards the patient's eye and touch the cornea. When you are just going to touch the cornea, you will see these two semicircles. Touch the cornea very carefully. Again I am saying you, when you just not have to be very fast while touching the cornea. Okay, so you have to see very carefully that patient's eye or patient's cornea does not get damaged. Right, so be very careful while touching the cornea. So now what is the requirement? The semicircles which you have seen over here should be of the same size. First thing is, they should be of the same size. They should touch the inner corners. Right, this semicircle you can see the inner corner is touched with the upper inner corner of the upper semicircle. So you need to have this thing so that you can note the intraocular pressure reading. The intraocular pressure reading measurement के लिए what you should have that these two inner margins of the semicircles should touch each other. Now one more important thing, that don't calc or note the readings while the reading the semicircles are in this position. They should not be touching or aligned like this, right? So इस तरह नहीं करना, you have to do like this. It is a correct way to measure the intraocular pressure. So now what will happen, acha, one more important thing, when you just have got the readings in this manner, okay, so you can see you got these semicircles. What you have to do, you have to move forward or backward. Where this, suppose you have measured the intraocular pressure, right? You are measuring the intraocular pressure and you got this. How you got this thing? So now you have to move this wheel up or down in order to see that are these semicircles going towards each other or are moving away. If the semicircles are moving away, go back to the previous reading until or unless you are getting this reading or this thing. So when you get, once you have got this image, you have to go back to the wheel and note the reading. Suppose it is 1, it means you have to you need to multiply this 1 with the 10. 1 into 10 equals to 10. This means that patient's intraocular pressure is 10 millimeter of mercury. So this is how you are going to calculate the intraocular pressure in the patient's eye. So now what will happen if you don't get any of the, or if the semicircles does not appear like this? So we are going back again to the thing I have told you. You have to move the semicircles above or below the reading you have noted. So now we are going to see the cases, or we are actually going to see that what will happen if your reading is more and you have set the wheel onto 10 but your intraocular pressure was 20. You have your intraocular pressure was below the 10 but you have marked it high. So we are going to discuss these cases. So let's move on and see what those situations are. So situation number 1 states that semicircles are very small and they are very far away from each other. So when you see these type of readings, when the semicircles are very far away to each other and are small in sizes, it means that patient's intraocular pressure is high. High from what? From what you have set onto the wheel. जितना wheel में आपने reading mark की हुई है उससे intraocular pressure ज़्यादा है. So what you have to do, you have to increase the reading from the wheel of measurement device and see if semicircle touches on inside. So again I have told you कि अगर बहुत दूर है so you need to rotate the wheel. measuring device के साथ जो wheel है उसको आपने rotate करना है, right? So कितना रोटेट करना है, इफ़ यू हैव सेट इट टू 10 और इतना दूर है तो 10 से थोड़ा आगे की तरफ मूव करें, 20 की तरफ लेके जाएं एंड सी दैट आइदर दीज सेमी सर्कल्स आर गोइंग टू टच और नॉट, राइट? Second condition is that your semicircles are very big. Over here you can see these are very big semicircles, right? And they overlap each other. You cannot see the second one because they have overlapped. So in this case you should know that IOP is less from what? From that you have set onto the wheel. If you have set 20 on the wheel of measuring device और इस तरह से आपको एक इमेज दिखती है, it means that the intraocular pressure is less than 20. So move the reading or decrease the value from the measurement wheel and just see that are these semicircles touching the inside corners or not. So very important thing, any changes in the readings on the wheel should be done off cornea because it can damage the corneal surface. So when you are increasing the wheel reading or decreasing the wheel reading, you should understand or you should know that don't touch the cornea at that time because it can damage the corneal surface. So do this thing while placing the measuring tip away from the cornea.